Welcome to this training where you will learn how motivated men and women break free from persistent bloating, abdominal pain, and chronic diarrhea or constipation. So they stop being afraid of food and can enjoy eating out again. Even if probiotics, restrictive diets, or cleanses haven't helped. My name is Fernando Bernal. I'm excited to share this information with you today. My hope is that by the end of this masterclass, to have stimulated your appetite, so to speak, for more information. Now, so that we're on the same page, let me say that this is for you if you're currently dealing with digestive issues. This is for you if you're tired of chronic constipation or diarrhea and abdominal pain from bloating. And lastly, but just as important, this is for you if you're serious, committed, and ready to put an end to the struggle. And listen, from experience, I know it's not easy, but it is possible. So stick with me for a bit. But first, let me ask you, have you ever wondered how some people can eat whatever foods they want and never seem to struggle with bloating, pain, indigestion, constipation, or going to the bathroom all the time because of chronic diarrhea? Or they try stuff like colon cleanses or some liver detox, and somehow they still see results. Meanwhile, you tried it all, and nothing seems to help. You still seem to feel terrible. And I wonder if you can relate to the frustration of not being able to wear the clothes that fit you nicely. Instead, you have to wear baggy clothes, not just to hide the bloating, but also just to feel comfortable. And can you relate to feeling like a prisoner in your own house due to constant diarrhea? And when you do go out, you have to know where the bathroom is, just in case. Or days go by before you actually go to the bathroom due to chronic constipation. If this is you, then I have good news for you. My promise to you. I'm going to show you a simple 3-step system that I created that can help you reduce your digestive problems in as little as 3 months. This system is based on my over 30 years of experience and research, which led to the writing of my book and the creation of this program. With these steps, you will eliminate bloating, pain, constipation, and or diarrhea, and enjoy eating out again without remedies or extreme diets. If and when you follow these 3 simple steps, you will experience improved digestion. This program will guide you step by step so that you'll feel comfortable in social settings. Have you ever been invited to a dinner and the host asks if you avoid certain foods because they're aware of your digestion problems? Or go to a restaurant and have to be careful what you order because you may end up being very bloated before the night is over. Well, I'm going to show you how this will become a thing of the past. But to arrive to that state of well-being, of optimal digestion, first I want you to know that you're not to blame. People say, well, it's your diet. Yes, if you're sitting around eating potato chips all day long while watching reruns of The Sopranos or whatever you like, well, yes, we've got a problem. But most of the clients that I successfully work with are not doing that. And like you, they are really trying to find a solution to problems that they did not invite into their lives. Like some of the men and women that you will meet later. The real problem is your gut has been invaded. Now, let's identify these invaders. Some may come by way of the use of some medications, antibiotics, or even excess use of antimicrobials. Sometimes I hear patients say that they take echinacea every day, or golden seal, or berberine. That's a popular one, and that's fine. However, remember the old saying, the dose makes the poison. In other words, any chemical, even water and oxygen, can be toxic if too much is ingested into the body and affect the gut's bacteria. So these natural antimicrobials that people are using, if overused, can be just as detrimental as the chronic use of antibiotics. Other invaders include unnoticed infections from our last vacation. And some research is suggesting that the beginning of most digestive problems, including diarrhea, constipation, and bloating, started when we became infected with some pathogenic bacteria. And one does not need to travel overseas to get infected. Infection can come by way of a restaurant or infected produce from a local supermarket. Now, another invader into our microbiome is prolonged stress. Now, that's a big one. Stress will certainly wreak havoc on the microbiome. And we'll talk more about the microbiome in a minute. Other offenders often overlook are extreme diets. We will talk more about that later. And if these invaders continue to disrupt our microbiome and become chronic, it would eventually lead to damage of the intestinal lining, the intestinal wall, the cells in our intestines that separate us from the outside world. Remember, the intestinal tract is outside of our body. It is open to the outside. It is like a tube. Let's see, the microphone may be on the way. It's like a tube. The heart, the liver, the kidneys are all inside our body. We can think of the intestines as a wall between us and the outside. And when it becomes damaged, they allow undigested particles to enter into the bloodstream. This is what is commonly addressed as a leaky gut. This leads to inflammation. When this happens, where food enters and waste products from bacteria enter the circulation, the immune system recognizes these particles as a threat or pathogen. The immune system does not know that it is a harmless piece of garbanzo or a pinto bean that, because of a leaky gut, entered the circulation. It just knows that whatever that is not self. It's an outsider and does not belong in the circulation. And quickly the immune system activates an inflammatory response to fight the protein from food and remove it from circulation. The reaction from the immune system is not necessarily a bad thing. We need the immune system to react, and acute inflammation is part of that process. However, inflammation affects the smooth muscles in the gut, which disrupts gut motility or movement that should be moving along the intestines. And this slowing down of movement in the intestines leads to a stagnation of food. And the stagnation of food feeds bacteria, leading to overgrowth, which leads to bloating and constipation or diarrhea. The list goes on. And when this becomes chronic, it eventually affects the entire body. Unlike acute inflammation, which, as we said earlier, is a normal and necessary response to injury or infection, chronic inflammation lingers, thus the word chronic, and can lead to long-term damage to tissues and organs. And research suggests that chronic inflammation can lead to autoimmune disorders. But the real culprit is not the inflammation. It is the dysbiosis, the imbalance of the microbiome, and we'll talk more about the microbiome in a minute, as I said before. And that's what this program aims to restore. And the sooner we address it, the better off we are. And here's the good news. I've figured out a simple way to solve this problem, and that's what I'll be showing you in this training. Let's take a closer look at how you can reduce the inflammation in your intestines, restore bacterial balance, and get rid of your digestive issues once and for all. The key to your success lies inside these 3 boxes. A proven 3-step system that will help you go from persistent bloating, abdominal pain, diarrhea or constipation or both, to enjoying your favorite foods and feeling comfortable in your own skin and clothes, of course. Here's a small taste of what it has done already for others just like you. This is Linda. Linda, who went from 4 years of bloating, abdominal pain, chronic constipation, and foul-smelling stool, to drastically improving her digestion to the point that bloating, constipation, and other digestive problems resolved by following the 3 steps of this program. You will hear more about her later. You'll also see how this helped Paul. Paul, who went from experiencing digestive problems as a child, from use of antibiotics for ear infections, And then in high school, antibiotics for facial blemishes. And through college, when he was diagnosed with IBS or irritable bowel syndrome, to managing his digestive issues and getting his life back as an adult. So proud of him. He did the work and it paid off. And I'll share a few more inspiring stories along the way. So just like Paul and Linda and many others in similar situations who made the choice to go from suffering with digestive problems to a life free of pain, bloating, and irregularity, you too can go from where you are now to this, being free from constant bloating and pain. You'll have a healthier gut and better absorption of nutrients and optimal digestion. You'll finally have less anxiety when out in public. No embarrassing moments when socializing or eating out. The best part, you don't have to guess anymore what to eat or what to take. Why? Because through this program, you'll gain the knowledge on how to live in harmony with your gut. And in turn, the gut will respond by giving you radiant health. You won't need to rely on just eating more fiber. I have an entire chapter on fiber in my book. It's that important. But the right fiber is what makes the difference. Some types of fiber are better than others, depending on the type of bacteria in the intestines. And how would you know? Well, you'll see that in a bit. This program has worked even when men and women have tried everything else and nothing had lasting results. And why this works? Because we test, not guess. You see, we are where we are now because we guessed too many times. Well, I guess I need to eat more fiber. Well, I guess I need to eat more frequently. Well, I guess I need to take probiotics. One of my favorite quotes from the great American playwright and screenwriter Tennessee Williams. He said, "Guessing isn't knowing." And if you're still here watching, it's because you want to know and you're tired of guessing. So even though having digestive problems isn't really your fault, it is your responsibility to do something about it. And that's why you are here. You see, when it comes to digestive problems, there is no magic bullet, no panacea, something that cures everything. No one size fits all. Because like our fingerprints and teeth, which are unique to each one of us, so is our digestive tract. So I want to commend you for still being here and wanting to know how to remedy your digestive complaints. You are demonstrating that you're the type of person who is willing to take back control and do what's needed to finally see results and stop guessing and trying this and trying that. Now, before we go any further, you might be wondering why you should even listen to what I have to say. So let me quickly give you a short background so that you can see that I really understand where you're coming from. I'm Fernando Bernal. I'm a certified functional medicine practitioner and a doctor of Oriental medicine. I've been in practice for over 30 years, and for the last 15 years or so, I've focused my practice in helping men and women get rid of their abdominal pain, reduce bloating, and enjoy food again. I am also a published author of my latest book, In the Belly of Darkness, a journey through the microbiome and its secrets. The book is based on my over 15 years of experience and research on the inner workings of the gut's bacteria and the overall effect it has on our well-being, from the physical to the emotional. Currently available at Amazon and Barnes & Noble. And I will tell you later how you can have a free copy of this groundbreaking book. I'm also a licensed acupuncture physician in Florida and in Colorado, nationally board certified, and hold active certification in blood chemistry analysis. I'm also a certified practitioner in stool testing and interpreting the results. A lot of doctors order stool tests, but they don't know how to interpret it. I'm trained on that. Currently, my practice is focused on holistic gastroenterology, working with patients with digestive complaints. And I'm extending my experience in this field to you and to those who are seeking for a solution to digestive disorders from an experienced practitioner. What I've learned from my years in practice and research is that you don't have to be a scientist to achieve the results you want. You just have to be committed. And the fact that you are here, taking the first step towards your bigger future, says a lot about your commitment. So great job. Let's keep going. Imagine how amazing it feels to enjoy food normally again. Imagine what it feels like to finally improve your digestion and lose some weight. All of that is possible when you understand and take action on three discoveries I made years ago that I'm sharing with you now. These discoveries will help you to go from chronic gut issues to a way healthier GI system. And they came about from an awareness that physicians of old used their five senses to help them arrive to a diagnosis of their patients' afflictions. They would smell, taste, see, hear, and touch the patient. These doctors would inquire about the nature of the stool, the smell, frequency, color, and so on. I'll give you an example. Before technology, diabetes was diagnosed by the physician tasting the patient's urine. If it was sweet, they would diagnose the patient with diabetes mellitus, the word mellitus coming from Latin meaning sweet, differentiating it from diabetes insipidus, insipidus meaning tasteless. So it was not uncommon to inquire about the waste or fluids from the body. We know that black tarry stool could indicate internal bleeding, or a sour smell on the breath could indicate too much stomach acid. A sweet smell on diarrhea has been linked to Clostridium difficile, an infection also known as C. diff. These three discoveries will provide you the keys that will help you to unlock and understand the three simple steps that will restore balance in your gut that in just a few minutes I will be sharing with you. When I set out on a journey to find the answers and solutions for my patients with digestive disorders, the first discovery that I made was that the poop doesn't lie. This is called the Bristol Stool Scale, and it has been used by clinicians and researchers since its creation in 1997 in Bristol in the UK, and it is the outcome of a prospective study, meaning that they observe a cohort or group of around 2,000 people, men and women, from around 1987 to 1989, who kept track of their evacuation frequency, how often they went to the bathroom, and the stool consistency. And while a visual inspection of the stool is not enough to get the full picture, it certainly was a starting point. The scale helps to identify bowel issues based on the appearance of the stool, which was classified by 7 types, from type 1 being very constipated to type 7 indicating diarrhea and or inflammation, and normal stool somewhere around 3 and 4. And the outcome of the study was to evaluate colonic transit time. In other words, how long does it take for the stool to move through the 5 feet or so in length of the colon, the large intestine, to its final destination, the toilet. The longer the transit time would lead to constipation, and conversely, the shorter the transit time would lead to loose stool or diarrhea. Now, the chart isn't perfect. It does not tell us why the patient's transit time is off, leading to either constipation or diarrhea. But it is certainly a starting point, and it helps to become aware of the intestinal environment of the gut by observing what comes out of it. So, one of these various possibilities for diarrhea or constipation could be the speed with which the food or fecal matter travels through the digestive tract. If we are suffering with diarrhea, constipation, bloating, and pain, how do we figure out where the problem lies? Let's take a look. Digestion really starts in the brain. When we smell food or hear food being cooked, the salivary glands go into action and the stomach begins to become more acidic. This is what is known as the cephalic phase of digestion, meaning cephalic meaning the head and the brain in it. But that's just the beginning. For a better understanding, we need to focus on 4 organs. Digestive problems arise when any or all of these organs are not functioning at optimal levels. If the stomach is not producing sufficient acid to break down the food, or is infected with a bacteria like H. pylori, and by the way, I dedicated an entire chapter on my book on H. pylori. That little bug can cause serious problems. Or the timing for the food to empty the stomach is too long, a condition known as gastroparesis.
food remains in the stomach for longer than normal, which will lead to nausea, vomiting, bloating, stomach pain, and acid reflux, among other symptoms. Also, keep in mind that the stomach acid is our first barrier of protection against bacteria that one may ingest from contaminated food. I mentioned this earlier about infections while on vacation. If the stomach acid is not low enough, it may give an opportunity to bacteria to go down to the small intestine. This should be a consideration for those who are taking proton pump inhibitors, PPIs, or over-the-counter antacids. But suffice it to say for now that it is a big player and responsible for many of your digestive symptoms. The gallbladder. If your gallbladder is not releasing sufficient bile, or if it has been removed, the digestion of fat is impaired. This can lead to malabsorption of fat and of fat-soluble vitamins, as we said before, A, E, D, and K. Furthermore, poor fat absorption can lead to diarrhea and fat in the stool. And a giveaway sign of fatty stool is that it's difficult to flush, it floats, and also leaves stool stains on the porcelain, and it smells very foul. The other problem with poor bile flow is that it can contribute to bacterial overgrowth in the small intestine because, as I said before, bile is an antibacterial substance. And a double whammy is when your stomach has low acid production and not protecting you from bacteria, and the bile is insufficient to kill the bacteria once it reaches the small intestine. This will lead to what is known as SIBO, or small intestinal bacterial overgrowth, a topic that I will touch on later. Now, the pancreas, an interesting little organ with two main functions. It is an endocrine gland, meaning that it releases hormones such as insulin and glucagon and somatostatin. And it is also an exocrine organ in that it releases proteins as digestive enzymes and bicarbonate. So pancreatic insufficiency can also be the culprit in digestive symptoms such as abdominal pain, gas and bloating, constipation and diarrhea, fatty stool, pale, oily, foul-smelling poop that floats. You see, fat is not digested the same way other macronutrients such as carbs and proteins are digested. Fat molecules are too big to be absorbed into the small intestine cells. Bile from the gallbladder and the liver has to first break down the fat, and then an enzyme from the pancreas finishes the job. And there's much more to fat absorption that is outside the scope of this discussion. So, if the pancreas is not producing enough enzymes, or there isn't enough bile from the gallbladder, you can now understand why fat will end up in the stool. Now, think about the intestines. All the products of the stomach, the pancreas, the gallbladder, and liver are dumped into the intestines. And the intestines are going to respond to how well the food broken down in the stomach, as well as bile or lack of bile from the gallbladder, and the enzymes or lack of enzymes from the pancreas. On top of that, the microbiota, the gut bacteria that resides in the intestines, plays a pivotal role in the further breaking down of food. So at this point, before we continue, I think it is important to have a basic understanding of what we're talking about when we speak of the microbiota and the microbiome. This understanding will help you down the road in your efforts to stop diarrhea, constipation, and bloating. Your relationship with the gut's bacteria is really a lifelong relationship. So it is to your advantage to maintain a good relationship with your friends in the gut. Because when that relationship is damaged, the host, us, are who pay the price with digestive symptoms and beyond. Let me define these two words that are implicated in digestive disorders when the gut is invaded: the microbiota and the microbiome. And currently, these are buzzwords. Everybody's talking about gut health, the gut bacteria, the gut-brain axis, and so on. It is so important that I decided to write a book on this topic. The microbiota refers to all the microorganisms that reside on and inside our bodies. These organisms are in the mouth, in the skin, in the lungs, in the vagina, in the bladder, and of course, in our gut. These microorganisms include bacteria, viruses, fungi, archaea, and so on. Now, let's define the microbiome. The microbiome refers to the relationship between these organisms, the gut bacteria, their interaction with each other and with us, the host, and the byproduct of the relationship between the various species of the microbiota. And that relationship is affected by pathogenic bacteria ingested from contaminated food, by the chemical environment within the gut, whether we have sufficient stomach acid or digestive enzymes, or how we feed the bacteria with nutrients. The byproduct of digestion from bacteria is another component of the microbiome. Yes, bacteria in the gut plays a big role in our digestion through fermentation. However, some of the products of bacteria fermentation are hydrogen gas, carbon dioxide gas, hydrogen sulfide gas, that rotten egg smell, and methane gas, all of which in excess can lead to constipation, diarrhea, or both. These gases can also lead to pain from bloating, like when you blow air into a balloon and it keeps getting bigger and bigger. The bloating then affects nerve endings in our guts, and that leads to pain associated with bloating. So it's not muscular pain, it's what we call visceral pain or organ pain. You see, we are a long tube of around 30 feet in length with a body built around this long tube. Starts in the mouth and it ends, well, you know where. And inside that tube, our intestines, there is an entire bacterial ecosystem. And as long as they coexist in harmony with each other, and we provide the nutrients they need to survive and keep pathogenic bacteria out of the intestines or in check, we have optimal digestion. But this ecosystem can be altered, disrupted, and that's where the problem starts. As I said earlier, the real problem is that your gut has been invaded and your microbiome has been disrupted. The question is, how do you know where the problem resides? Of course, it's a rhetorical question since I know you can't answer me right now. Perhaps later we can discuss this in a one-on-one conversation. But really, how would you know? The answer is because we test and we do not guess. Visual inspection of the stool, such as the one from the Bristol scale that we saw earlier, can only tell us so much. But to get into the weeds, we need to have a stool test, which will give us a good picture of the microbiome and the relationship between the various species that colonize our intestines. We can see if we have pathogenic bacteria, viruses, and we can tell if there is balance between the bacteria, all of which can contribute when out of balance to diarrhea, constipation, or both, as well as bloating and pain. This was my first discovery, that the poop doesn't lie. And this discovery is at the heart of this program. Every client I have helped has undergone the same stool testing protocol. And I know this is not fun. I know this is not the most pleasant thing to do. But it's a small inconvenience with huge payouts. Remember Linda? Before 4 years of bloating, abdominal pain, chronic constipation, foul-smelling stool, nearly became dehydrated due to diarrhea and vomiting. She tried antibiotics, probiotics, procedures like endoscopies and colonoscopies. After testing her stool and testing for food sensitivities and implementing the 3 simple step program, the results: reduced bloating, improved mood, more social, and enjoying food once again. Now, my second discovery was that the breath doesn't lie. There are 4 main ways for the body to remove waste through feces, sweat, urine, and breath. All of these waste products, when examined, can give us an idea of what's going on inside the body. You may have heard the saying, one man's garbage, another man's evidence. Just like a crime forensic scientist examines garbage from a house to get clues regarding a crime that's being investigated, the waste from the human body is no exception in revealing what's going on inside. The breath then opens another window into the gut and may reveal the reason for your bloating, your constipation, or diarrhea. And here I'm not necessarily talking about the smell of the breath. Yes, that alone can be indicative of oral dysbiosis or poor oral health, or gut imbalances, or other conditions that we spoke about earlier. I'm talking about something else. Now, here's how it works. Just like carbon dioxide finds its way to the lungs through the blood to be exhaled in exchange for fresh oxygen, so do the gases from bacterial fermentation of food that generates hydrogen gas, methane gas, hydrogen sulfide gas, find their way through the blood to the lungs. And just like a breathalyzer can measure the amount of alcohol a person may have consumed, the levels of the gases the bacteria in our gut produce can also be measured in the breath. Now, we're all going to show levels of these gases in our breath since we all have commensal bacteria. But there is a threshold. When these levels of gases go above that threshold, we have a problem. This will lead to what is known as SIBO, or small intestinal bacterial overgrowth. The SIBO breath test is not that complicated, and I would be happy to discuss it with you on a one-on-one Zoom conversation if you like. Breath tests are also used to detect H. pylori and to see if a patient has lactose intolerance. It was this SIBO test that helped Carol. Carol, before digestive problems in her childhood, had constant gas. The breaking point was soiling her pants during a meeting. She had constant diarrhea, and it can be so debilitating. She also tried antibiotics, anti-inflammatory diets, fiber, a carnivorous diet, eating nothing but meat. She tried a program, and the results, less bloating, normal bowel movements. She got her life back. Now, so let's move on now to our third discovery. The blood doesn't lie. And this discovery has to do with digestive disorders related to food allergies, food sensitivities, and food intolerance. I dedicated an entire chapter in my book to this subject. There's a lot of misunderstanding regarding the differences between food allergies, food intolerance, and food sensitivities. Let's learn to tell the difference between food allergies and food intolerance and food sensitivities, shall we? When someone has a food allergy, he or she knows it quickly. A food allergy is when your immune system mistakes an ingredient or type of food for a harmful substance or a pathogen. When this happens, your body produces chemicals that fight the perceived threat, and you know it within a few minutes to an hour after eating the food. In some people, allergic reactions are more severe and can even be fatal. Now, let's take a look at food intolerance. Food intolerance is the inability to digest or process foods, often due to poor pancreatic release of the right enzyme. Food intolerance symptoms are inconvenient and uncomfortable, but they are not life-threatening. And unlike food allergies, they do not involve the immune system. They usually show up within a few hours of consumption and may include any of the like bloating and gas, diarrhea, stomach pain, heartburn, nausea, that type of thing. But it's not as drastic as a food allergy. Now, let's talk about food sensitivities. Food sensitivity is when a certain food prompts the immune system to create internal inflammation. By contrast, with food allergies, where the immune system mistakes an allergen, such as a protein from food, as harmful, leading to strong immune reaction, in food sensitivities, the reaction is not as drastic. In this program, we test for 88 different types of foods. The test shows us to which food you may be allergic, sensitive, or have built a tolerance. And it was with a blood sensitivity test that we were able to customize an anti-inflammatory diet for Laura. Laura, who had a mixture of complaints that overlap with various GI disorders, including H. pylori, bloating, diarrhea, constipation, nausea, chronic runny nose, hives, anxiety, itchy skin, rosacea, acid reflux, you name it. Laura had it. She tried over-the-counter antacids, topical creams for itching, laxatives, antihistamines. Now Laura lives a happy, normal life. The symptoms that made her life miserable for so many years have abated and are now a thing of the past. Her skin is lustrous, her sinuses are clear, she has lost weight, and she feels good and great about herself. And we were able to help her because we didn't guess. And the food sensitivity test helped us to tailor her anti-inflammatory program to remove foods that even she was not aware were causing some of her symptoms. She's so much better now. And now finally we come to what you've been so patiently waiting for. The 3 simple steps that have helped many of my patients and will make a difference in your life, should you take further action. Remember these 3 boxes that I alluded to earlier? Well, now I'm going to show you the 3-step system I use to help clients like those I've shown you to achieve such remarkable results. It is called the Optimal Digestion Blueprint. The Optimal Digestion Blueprint. It's simple, it works, it has 3 steps. The first step is remove. This step is crucial in your healing journey and will determine everything you do afterward. But what do we remove, you may ask? Well, depends on what we have found in the test. Your story is probably similar to that of Laura, Paul, or Linda, but is also different in so many ways. We could guess what to remove, but why? Don't you want to know? As a practitioner, I certainly want to know. But I'll give you some ideas. There could be an overgrowth of some of the commensal bacteria. We would like to lessen that, lower that overgrowth, and bring it back to harmony with the rest of the microbiome. Perhaps there is H. pylori. You certainly want to remove the nasty little bug from your stomach. Or maybe there's a particular food that produces symptoms 2 to 3 days after eating it. I don't remember what I ate 3 days ago, but with a food sensitivity test, we may just be able to zero in right onto that food. And please understand that removing the food does not mean necessarily for a lifetime. We remove it long enough to tame the immune system down and to lessen the inflammation. After we remove, we must replace. Again, you may ask, replace with what? First, through testing, we see what we are missing. For example, if we see too much fat in the stool, as you already learned from earlier in this masterclass, we may have an issue with bile. Remember, we said that bile was important for breaking down fat we consume, so perhaps we should consider replacing with a bile supplement. So see, we're not guessing. We're not going willy-nilly here, taking this thing or that just because somebody on Facebook said to take it. We're asking your body what it needs and what it does not need by testing, not by guessing. And now let's talk about repair. Repair is the 3rd step. What are we repairing? Well, we'll start to slowly rebuild the walls in the intestine, the damage to the intestinal lining that might have led to a leaky gut. You will learn about providing the fuel that the cells need to repair damaged cells so that they can function properly. You will learn to repair the mucosal lining that protects the cells in the intestines and that provide a barrier against pathogens. Inflammation really destroys the mucosal lining. You take your newfound confidence and wisdom to live a life where you're no longer at the mercy of your gut. With debilitating diarrhea, constipation, bloating, pain, you will learn to repair that relationship with the microbiome that we spoke about earlier, where you benefit from the microbiome and the microbiome benefits from you, the host, and together you can enjoy food again. You are a unique individual, and we are at the cutting edge of individualized medicine. So these 3 steps are not a cookie-cutter type of solution or one-size-fits-all kind of thing. Each one of my clients are different, so there are times when we may need to repair first and remove later. The order in which these steps are taken is really determined by the results of the tests. With this in place, when you have the optimal digestion blueprint, you finally have a proven path to solve the root problems of your digestive issues. With this, you have an established process that can get the results that you felt were so unattainable for so long. This has worked for the clients I've just shown you and many more. Is there a reason to believe this could not help you too? The very fact that you're still watching, this tells me that you are committed to controlling your bloating and chronic abdominal pain. Otherwise, you would have been gone a long time ago. But if you're anything like me, and thus I've helped, you don't want to waste any more of your time and money. You want a proven system that actually works. You now know that your gut was invaded, and this invasion disrupted your gut's microbiome. We've seen that the old way of doing things, which includes most of the common approaches, simply doesn't work. And guessing is a road that leads to nowhere. And I've shown you the optimal digestion blueprint that actually helps people just like you go to reduce pain related to digestive issues without medications or extreme diets. You can do this. We can do it together. Just imagine how great it feels when you no longer have to struggle with feeling bad because of your gut's health. Imagine how good it feels when you can finally enjoy eating out again. And if you would like me to help you do this, I would be delighted. Remember, that's my mission. Because there's one thing I know for sure. Doing this alone is not easy. In fact, it's a surefire way for things to get worse. You've probably realized that by now. You could continue to try, but you'll probably continue to waste a lot of time and money and needless frustration. It would be like going across the country without a GPS or any signs on the road or a map to tell you where to go. Here's why. It has cost me tens of thousands of dollars and many years of advanced schooling and continuing education, including working with clients and patients and figuring all of this out, to finally creating a solution that actually works, all so that you don't have to. Now, let's talk about what successful people do. Here we are now. And several months from now will be the future that you create. First, we all start by getting clear on what we want and why it's important to us. But those who struggle in life ask one question that takes them down the wrong path. And that question is, how? How can I do this on my own? And because they don't know how, they continue to struggle. After all, if they did know how, they already have what they want, but they don't. I call this red line the struggle line. Now, here's what successful people like us do. We get clear on what we want and why it's important to us, but instead of asking how, we ask a different question. Who? Who can help me get there faster? Who's been there and done this several times? Who can guide me so that I am not wasting my money and time and I can actually get the results that I'm after? See, we all stand on the shoulders of giants. Someone before us has paved the path. I call this green line the success line. What's interesting is that down the road, these two curves are very far apart, near impossible to jump from the red back to the green. But right now, they are literally touching each other. Right now, you've come to a fork on the road. You have the chance to set the course by making a simple decision to get on the green line. And guess what? You're already on the green line just by choosing to watch this masterclass. And it wouldn't make any sense to get off that success path and struggle now, would it? Of course, you're already moving in the right direction. So let's stay on the green line and actually help you succeed once and for all. And you're just a Zoom call away from making all that happen. And here's exactly how I can help you. I would like to offer you a free assessment where I can better assess where you're at, what's held you back, and how we can actually get the results that you're wanting in less time. During this digestion assessment, we'll do three things. First, we'll get clear on the number one reason you're still dealing with digestive problems. A lot of times, it's something my clients are completely unaware of until we take a closer look under the hood to really see what's going on. As I often say, it's just like when we are driving a car. The biggest danger you face is the blind spot you cannot see. So first, we'll bring this blind spot to light so we know what we're dealing with. Second, we'll uncover the specific challenges that have held you back. We'll have a look at what you've tried, what's been getting in the way, and finally, once we are clear on where you're at, where you want to go, and what's been holding you back from getting there, we can then create a game plan to get you there. to finally eliminating bloating and pain and other related symptoms, just like Linda, Paul, and Laura. Remember those cases I showed you earlier? It all started with this digestion assessment. So if you're ready to put an end to feeling anxious in social settings because of your gut, putting an end to diarrhea, constipation, bloating, and pain, if you're 100% committed to actually getting closer to optimizing your digestion and a lot faster and safer, and if you want to do it all without multiple supplements or probiotics, this could be for you. Now, although I charge a substantial amount of money for my time and expertise, here's why I'm extending this consult, this assessment to you for free. We don't know each other yet, and I believe that the best way to build trust is to actually help you before expecting anything. And I just think that that is fair. I also know that, having done this many times before, a good percentage of the people that I work with want my help beyond our initial meeting. And if that's you, then great. If not, that's okay as well. But before we go any further, you need to know that I can't help everyone. And I don't know how much longer I'll be offering these assessments for free. And the last thing I want to do is waste your time if you're not the type of person who will see results. This is not for you if you're unwilling to follow a structured program and make basic lifestyle changes. If you're not willing to study the material that the program provides. This is not for you if you're unable to invest in your gut's health. And I say that because although this assessment is completely free, I also only have so many hours in a day. Therefore, I can only prioritize those who are in a position, should they want my help beyond this free assessment, to be able to invest in fixing this problem once and for all. And of course, there's a financial investment. Now, if improving your situation is valuable enough, where that makes sense, then this free assessment could be for you. This is for you if you're someone who's fully committed to taking control of their gut health. You are willing to do what it takes. This is for you if this is an absolute must for you now. So if you meet this criteria, then this is for you. I don't see any reason you couldn't see the same results Linda, Paul, and Laura did, and many others. Simply click the link below to book your free digestion assessment now. So if you want to uncover what's really been keeping you from taking control of your gut's health, get a customized plan for your specific situation, and see if working together will make the most sense for you to even get faster results, time is of an essence. And here's why. You have two choices. Stay on the green line and book your free consultation now, your free assessment now, so we can get you to a healthier gut and free of digestive symptoms much faster. Or go back to what you were doing before and keep guessing. Those are the two choices you have. But only one of these choices will get you closer to the results that you're looking for. The very reason you signed up to watch this masterclass in the first place. So take advantage of this opportunity now. Simply click the link below to book your free assessment, and let's do this together. And earlier I told you how you can get a free copy of my book, In the Belly of Darkness, A Journey Through the Microbiome and Its Secrets, for free. It's very simple. Book a free assessment Zoom meeting with me. Show up and finish the call for the digestive assessment that I'll offer to you for free. And then I'll give you two choices. Get a free ebook version of my book for free, currently selling on Amazon and Barnes & Noble, or get a paperback book and just pay for the shipping and handling, a total of $9.97. The paperback is currently selling for $21.97. Yours, free. Just pay the shipping and handling. No strings attached. If you choose the paperback, I'll sign it and personalize it by mentioning your name with my signature. The book is a wealth of knowledge based on my 30 years of clinical experience. You have nothing to lose but pain, bloating, and digestive problems that have caused you so much misery, and everything to gain. So book your call now, shall we? Thank you for your time, and I look forward to speaking with you on the other side. I'm Fernando Bernal.